Hello. I'm Paweł Sieczkiewicz. I'm waiting for the presentation. Meantime, I'm the proud student of the Kazimiński University, not only the alumni, but also the current student, because I came back here to finish my master's degree. My path of the studying wasn't very straight. I should finish it a few years ago, but maybe I will tell you a little more. I will tell about the future health, but I will start with the status quo, which I think was one of the most important things that determined my life for the next years. And the first thing when I started with the struggling with the status quo was sport. When I was 12, I went for the first training, and my trainer said, maybe Paweł, or he called me Sieczkiewicz for the surname Sieczkiewicz, maybe you will try ballet or dancing instead of kickboxing. 12 years old, maybe, but I want to do kickboxing. So it was the first status quo for me. My other friends were more talented, were doing better, but I thought that if I will be training very hard, I will get it. So for the next 15 years, I was doing it. I didn't need 15 years. After 7 years, I did my first championship of kickboxing. I would not do that without training and deciding then, even if the trainer was sending me for dancing, that it can be done. If I will put enough hard work, no of status quo can be challenged. Second was the studying. I started studies on Technology University of Warsaw in 2011, and after 3 semesters, they told me that probably I'm not enough good to study management. So they kicked me out after 1.5 years of studying. After that, I was building company, and a few months ago, the Kazimiński University awarded me with a Lion of the Kazimiński. Maybe not because of my great achievements in studying, but probably I did something that the great jury told it's good enough to award with this great prize. But status quo may affect one life, like in my example, or many, many lives. This gentleman is Felix Zandman, or rather was. He died a few years ago. And this man, when he was 14, the Second World War has started. When he was 14 or 15 years old, he had to hide under the floor. The Polish family was feeding him. Only his uncle has survived. So he and his uncle were hiding under the floor, and his uncle was learning him the maths, mathematics, how to count, etc. For 2 years they were hiding under the floor. After the Second World War has finished, he moved to France. He started studying, and after that, in few years, he started 2 companies. These 2 companies are right now hiring more than 22,000 of people. Probably it was quite impossible for him to think about when he was hiding under the floor, that he will manage to survive, that he will manage to build such great things that will affect lives of that number of people. Not only people who are working in his company, but the people who are using the products, that the products were used by millions of people. These 2 companies were and are still on NASDAQ with billions of dollars of revenue. And in my opinion, there are 2 things that may help you to win with the status quo. First, if you are escaping from something, and the second, when you are trying to achieve something. And there is one thing which is the same for these 2 things, and this is determination. If you got enough determination, you can challenge the status quo and reach something that you think can be impossible when you are thinking about it. But the future will tell you if it's possible or not. So we can have the determination basing because you want to escape from some place or to achieve something and you got enough power, or you don't even think you got the power to achieve that yet. So the future of health. When I was struggling with the status quo in my previous steps of the life, I thought, okay, I done. It's good enough. Maybe let's go for something bigger. If you are living in Poland, there's a huge chance that you will visit the doctor 3.7 times next year. On average, of course, but when you are visiting a doctor, you would like to visit him in a great space, but usually it looks like this. And even if you are going to a doctor, you need to wait with 6 people in the line, etc. And why is it like this? Because you are very often going to a doctor with unnecessary problems. Other people are going to a doctor with unnecessary problems. The problems that could be done online, or the problems that could be done by a technology that could be done faster, but every of these problems are getting to the same line, people who are waiting to a doctor. And the second problem is that we got 2.2 doctors per 1,000 of people. And it will not get better, because our society is getting older and older. Probably we will need more doctors visits per year. And what is about doctor UX? So what is the user experience of visiting a doctor? It's about waiting for the short time in the line. It's about traveling to the clinic, how far you need to travel to get the doctor opinion. And are the other 6 people are waiting with you in a line? Because whenever there's an epidemic in the media, probably you are thinking that these people may just have this very harmful sickness. And what is the most important? How will the contact with a doctor and other medical staff look like in this clinic? Will the doctor be polite, or they will push you to go fast and come for the next patient? And what is taking, how the quality of the treatment looks like? The faster you will get to a doctor, the higher chance you will get the problem will be solved easy and fast without any necessary drugs. The later you will get to a doctor, there's probability for your sickness that it will increase, and you will need to visit a hospital. When you already got the therapy, so the doctor has provided you drugs that you need to take, usually right now the doctor is seeing you only for the next visit, offline again. But if the doctor could visit you anytime that your pulse is increasing or your temperature is increasing, and talk to you on a video chat or something else, he could provide you faster new drugs. And this already happens in private insurance companies. The private market is measuring the money, is measuring the satisfaction of their clients. This is the reason why they are doing it. But these things can be also implemented in the public health system. But first, we need to go digital, because only when we got the data, we can measure something. Only when we got the data, we can predict also what could happen with the patient and with the whole system. To get the digital, first we need, in Poland we call it elektroniczna dokumentacja medyczna. In Word, it's EHR, electronic health record. So your data must be stored in a cloud or must be stored on the servers to let other doctors to share your medical data. Because anytime you are going to a next doctor and you will not get your whole medical documentation, the next doctor will put you a diagnosis not basing on your whole history. And of course, it decreases the probability that you will get treated well. Many things can be done online because of, for example, analyzing health results when you are coming to a doctor and the doctor is not even looking at your face, but only your medical documentation. When you are coming to a doctor to postpone the prescription, to get a new one, or to ask a doctor which doctor you should visit. Right now, we got around 88% of accuracy. So after the online consultation, patient is going for the offline visit in 12% of cases when we are talking about the general practitioner. But of course, it's not for providing right now online consultation for every case that patient has got. The most important thing is which problem can be sent for the online consultation and which not. And we are doing it based on data. So if you got every of patient's data in an electronic way, you can predict and check, okay, with these symptoms, women 30 years old were coming back for the offline visit. With this symptom, the other symptoms, the man 26 years old was not coming for the offline visit again. And based on this, in medicine we are calling it triage. So triage is helping you to provide the flow for the patient, where the patient should go, which doctor he should see. Does this patient need to take some health results before going to a doctor? Because if you will do this health results, next visit will be already about treating him, not telling him, okay, you should first go and make a blood test. Whenever you are doing it, you are decreasing a number of visits that is needed to help with your treatment. For a whole population, it means thousands of unnecessary visits less. The less visits we are doing, the less waiting time to a doctor we got. And we have divided the visit to a doctor into 3 blocks. First is collecting the data. So doctor is asking for questions about your problem. Okay, I got a headache, etc. And it takes around 6 minutes. After that, the doctor is putting you diagnose. Something is what is the most important in your case, and it lasts around 30 minutes only. And after that, the doctor is doing administrative work. So he's providing medical documentation for a future, for the next doctor who will be visiting you, or for next visit when you will be visiting a doctor. Why it takes so long time? Because doctors are putting data in 2 fingers. Because the doctors need to fill a lot of data that already were filled in the past in other firm, but no one is copying it. The software is not doing that. So we have, as we are digital native, we have taken this data and we are thinking where we can decrease this number of administrative work, the repeatable work that is done by a doctor. So we have taken the artificial intelligence to this, and we were starting to do symptom checking. So the patient is providing to the data that I got a headache, I got a foot pain, and the computer is looking for the similar cases in the past. Okay, so probably, do you also cough? What is the type of the cough? From how many days you got it? And our computer is asking this question. So the doctor, when he's getting to the consultation, is already getting this information, gets this whole information. The KPI for us, for the technology, is that doctor shouldn't ask any more questions. If it happens, we are already saving few minutes of the time of a doctor. Right now, we see that thanks to this technology, doctor can make 1 more patient during an hour. So it means around 20% of more patients per doctor per month. Usually doctors make a few hundreds of patients in a stationary visit. And after that, we are helping to a doctor to provide a diagnosis. So basing on the symptoms, probably it was this diagnosis. Right now we got around 80% of accuracy, that what computer says, the doctor agree with that. And again, if doctor doesn't agree, we got the learning line. So the computer is thinking why he didn't agree. And next time he will provide some other advices probably. And if other doctors will agree, again he's getting better and better. But what is the most important is that we are giving a prediction to a doctor what probably he will put into medical documentation to avoid this other 5-6 minutes of putting data of the patient, to get out of him the administrative work. We are doing it currently for online consultation where we got the digital input. So the doctor and patient are talking through video, chat, or telephone. And right now we are working to get it for the stationary visit. The online consultation number will not be never big as offline visits. So we will put on the desk of the doctor and patient the box that will be listening to the visit. And basing on this, this sound, we will divide what the doctor said, what the patient said, and after that provide the doctor this input for the diagnosis and input for the medical documentation. There are also some things that the governments are implementing. One of these is the e-prescription. Thanks to this, we will be able to get to a doctor, get to the pharmacy and buy a drug just after visiting a doctor online. Right now, there's a huge problem for the telemedicine that when the doctor will provide you a prescription, you need to send it through a courier. When you will get the e-prescription, you will be able to go to the pharmacy just after this online consultation and use this prescription and buy a drug. We have asked the doctor, but how we can make more online consultations? Because you can imagine that basing only on what people are saying through chat, video, telephone, the number of the solutions that can be provided by the doctor is not as huge as when he can touch a patient. So we have asked these doctors, all right, so if we will provide to patients these medical devices to their home, does it increase the number of the diagnoses that you can provide? Yes, but of course there's a problem how to provide these medical devices to patients' homes. They are very expensive. Getting these sets to patients' homes will be also using some time. So we have combined these two things, pharmacies and medical devices, and we have created the offline points, where you can make a video consultation using medical devices to increase the number of teleconsultations that are finishing with the diagnosis. And just after that, the patient can buy an e-prescription already in the pharmacy where he is. In this telemedicine kiosk, you can use the stethoscope, ECG, pulse meter, etc., where we're doing nearly the same what the doctor is doing on an offline visit. Also, even with the camera, the doctor, with the help of the pharmacist or the nurse, can look into your throat. So 80% of cases that who are going with the infection to the doctor can be solved right now online after the telemedicine visit. The next thing in the future will be data that will be provided from the patient just when he's living his normal life, wearing watches, measuring health with the sets of telemedicine devices at his home, using even the telemedicine stethoscopes at his home, because the price will be cheaper and cheaper. I'm sure that insurance companies, of course, they will be always faster than the government, will provide you the free stethoscopes as a benefit to the subscriptions that you are paying, that your parents are paying, that your boss is paying. Thanks to this, the insurance companies want to convince you to make more online consultations, because when you will get a doctor faster, probably you will finish your therapy faster. It means it will be cheaper for the insurance companies. It's hard to provide this information to the government, because the government needs to always do it on a very huge scale. This is something that is right now changing. Also, governments are starting to make pilots, because when they got data on their groups of users, or groups of patients, they are more convenient to do something on a bigger scale. So when the doctor will get a lot of information about you, and he will be storing it in electronic medical data, he will be able to, based on your past, what was your health results, will provide you better diagnosis. But algorithms will be taking care about your health, what's your status, if the status is changing, and if it is, the doctor will contact you. So in future, the model will be reversed. The doctor will be informed by the computer that this patient needs to get in touch with him. Because right now the patient is contacting the doctor when he's already ill. When you know that you will need to wait in the lines, that you will need to travel to the clinic, half a city, so you are not going very often to the doctor because you don't want to get this bad user experience. You need to be very, very ill to get to a doctor right now usually, when we are talking about young people. But the doctor will be measuring your health with the usage of the algorithm, and he will contact you by your phone, by your messenger application. And we are coming back to the status quo. It's something that maybe right now impossible to achieve, or most of people think it's impossible to achieve, but I'm sure it happened. If we would tell about it a few years ago, it will be more impossible, because the private insurance were also not doing it. But right now, we got the reason to believe that it's something that's happening on private market, which is always few years ahead. And I'm sure that in the future, when we will meet once again, you will see that also in the public sector, you got a doctor in a digital way, and the doctor is contacting you. Thank you.